I can say so many things about what leadership have taught me. It has taught me that throughout life, there are many hurdles, and it's how we get over those hurdles that make us the person that we become.
Sylvia Barchue is an author, creative visionary, and transformational healthcare leader with more than 35 years of experience. Rising from staff nurse to associate medical center director at the James J. Peters VA Medical Center in the Bronx, she has led hundreds of healthcare professionals while championing mentorship, patient advocacy, and innovation in veteran care. Through her leadership, writing, and coaching, Sylvia continues to inspire the next generation of healthcare leaders.
Remember to step back, because sometimes we really have to step back and listen to what others are telling us. We don't always have the answers. Leadership means collaboration. It means sometimes walking in other people's shoes in order to understand where they're coming from.
In this episode, we dive into Sylvia's journey, how she discovered her passion, how creativity and innovation shaped her leadership, and the wisdom that she has for anyone who is searching for their own purpose. Sylvia, welcome. So excited to have you here this evening. Thank you for joining us.
Nicole, this is a pleasure. Okay, I love to talk about my passion and everything else that goes with it. This is a good opportunity for me today, and thank you very much.
Well, you're welcome. I'm honored to have you here. So to get started, you've had such a remarkable journey from beginning your nursing training in London to serving in major leadership roles within the VA. Can you take us back to the very beginning? How did you get started on this path?
Oh my goodness. I went to London to train to become a nurse. And after my 3-year training, which I successfully completed my exam and became a registered nurse, I think things started to take off from there. I do realize that my passion for patient care was really in the intensive care unit setting. That meant I had to go back to do a postgrad, which took me another year. The postgrad was, thankfully, I was selected at that time, one of the top hospitals in London. And the first 6 months was working in a surgical ICU, coronary care unit, spending a month in each one of them, and spending 1 month in the operating room with anesthesia, actually learning the drugs to use for intubate and learning how to intubate patients, and also a stint in a burn center. Of everything that I went through, being in that burn center was really, really very eye-opening. It was so horrible to see young kids who were being burned 2nd degree, 3rd degree because of accidents and stuff like that. And once I completed that 6-month training, you're interviewed by a chief for anesthesia, and it's a hospital exam you have to take first, and then you take a national exam before you become certified. And the 6-month training didn't end there. You had to do another 6 months working in an intensive care unit before you're actually recognized as a critical care nurse. The training at that time in England was totally different than here with the critical care training here. It's totally different. It was much more intense and much more patient oriented. After that, I started designing intensive care units. And actually, I was in one unit one evening that I had worked on, that this gentleman approached me saying that he knew I had worked in that unit. He was interested. And he was building a little hospital in a little town in Arkansas. Never heard about Arkansas in my life. And he wanted me to help him to design his unit. I signed a contract with him that same evening. And that's how I immigrated. I came to the United States. I finished the unit. I worked with him for 2 years, but it was a small intensive care unit and it really wasn't what I wanted. So I transferred into Little Rock, Arkansas, to work at St. Vincent's Infirmary. That was an experience. It was a 20-bedded combined unit, and I had everything I needed to learn or to transfer from my skills in England to this country. And I started really in the unit as a staff nurse in intensive care, and within 3 months, the surgeon who ran the open heart team selected me to be one of his open heart nurses. I was the first Black that he had ever brought into the program. That's what I heard. It was all based, of course, on my skills and my interests. And an open heart patient at that time, when you are assigned that patient, that is your patient. There were standards of care. After surgery, the patient came directly to you on the balloon pump, and that's what keep the hearts pumping post-surgery, during and post-surgery. You are allowed to decide based on lab work, does a patient need a blood transfusion? Does a patient need potassium in the drip? The patient is intubated. Is the patient ready for extubation? You work with respiratory. So that patient was your patient. At the same time, the head nurse in the unit decided that I should be promoted to a charge nurse role. And I'm saying, wait a minute, I've only been here 3 months. You're just dumping everything on me. And that presented a little bit of problem, which I have to go into a little bit, because as basically one of the few Black nurses in that unit who were rising, there were some other Black American nurses who had an issue, who felt that I could not be trusted. I was just carrying tales, and that's why I was moving up the ladder. And that I had to confront them and address it with them. No, this is not me. You guys are submissive. You're not really, your skills need to be worked on. And I need you to look within yourself instead of thinking that I'm doing things that are unethical and is beyond me. And as a matter of fact, when I left that intensive care unit and came up to the New York area, that particular surgeon told me point blank, I don't know why you're moving up there, but if it doesn't work, you don't even have to apply. Just turn up here to work and you have your job back. And I said, thank you very much. Anyway, transition into what I felt coming into Arkansas as a British trained nurse. I think it was the best place for me to be, entering into another country as a nurse, because I saw nursing exemplified at such a high level. Patient care was such a high level. It was just like me walking into a good healthcare system, into a good healthcare arena in Arkansas, in both places I worked in. When I moved into the New York area, I needed a job immediately. My license, somebody said, you can work in any VA hospital with a license from any state. So I applied at the James J. Peters VA. It was called the Bronx VA at that time. Was accepted as a staff nurse in the ICU. And I'm going to just let's fast forward. I started there in the ICU. It was a small unit. Within 2 years, I became the head nurse of that same unit. And over my early career at the JJP, I started getting more and more assignments, moving up the ladder, incorporating different units under my umbrella. And after a while, I became the head nurse of a 20-bedded ICU, which I designed. So anyone walking into the Bronx or JJPVA right now into the intensive care unit there, that's Sylvia Barchue's design. It's
amazing.
It's
amazing. I just want to say congratulations. Congratulations.
It's a 20-bedded ICU, medical, surgical, and coronary care patients under one umbrella. And that again tested my skills as a new leader, because I assumed responsibility for nurses that I had not supervised in the past. They rotated to me, but they became my nurses. And it was not a bad transition at all. Earlier on in my career in the ICU there, I would go in the evenings and there would be issues and I'm just working on patients, changing things. And many of the doctors used to say to me all the time, why yourself? And I say, you need to be the head nurse in this unit because you really have got what it takes to be a head nurse. As a matter of fact, when I eventually became the head nurse, I did not want to apply for the job, but the then chief of surgery said, listen, while you were acting, I had no headaches. I see how a unit can function and you are going to be the head nurse in this unit. And I took his advice. I continued my path. My thing is patient care. You've got to give good patient care. And I said to young nurses who I know are going into nursing school, listen, if your heart is not in it, please do not go to nursing school. It's hard. I wrote an article many years ago, the dirty end of it is meaning you've got to get in there and be there for the patient. Forget your issues outside and just come in here to provide the care that the patient needs.
Yeah.
So I hope I've answered. I can go on and on, but I won't. But
no, you've shared a lot. You've shared so much. I just want to say congratulations. The rigor, the excellence that's there, and the fact that people were able to see your not your capability, but everything that you brought to the table, your skill set, and the fact that you're an innovator. You are a leader. Before you were even stepping in the role, right? You led from the position you were in.
Yeah.
Patient care is at the center of everything that's your focus. The intensive care center. You mentioned the burn unit, but why the intensive care center? What about the intensive care center made you say, okay, this is my purpose. This is a part of my passion and purpose. This is why I'm here.
I felt that that's an area where patients are severely ill and really need skills and dedication to get them to the next level. Because working in an intensive care, it's a high energy situation. You have to have the knowledge and the skills to be able to act just like this. Something is happening, you got to get in there and start doing all that you can to keep that patient alive. And I liked the activity there, the high level intensity. Plus, I love the knowledge that I was obtaining in being in such a setting. In England, in the afternoon, when there's a downtime, all the doctors would come in, the cardiologists would come in and teach you. Do you have anything that happened today that you were concerned about, that you need more education on? And they would sit with you. They would go through the EKG strips. That's when I realized all cardiologists have a tendency of interpreting strips differently, but getting right to the point. So my thing was, it was also to see nurses working together to make sure that that patient in your care, whether it's my patient or somebody else's patient, that we do the best we can as a group to get that patient through whatever is happening at that particular time. That's why I chose intensive care.
Yeah, that makes sense. And because of your passion and your dedication, I'm sure you've saved many lives. And the fact that you have made changes. We go into a VA hospital, 20-bed unit is still there, courtesy of the work and the vision that you have, or you had at the time. How has creativity and innovation played a role in your work as a nurse, leader, and visionary?
That's a question that I can really go. Nurses on a whole are creative people. Okay, we see nurses on a whole are creative people.
Tell me more, because when I see a nurse, that's not the first word that comes to mind. I mean, I see innovation.
Listen, you have an assignment, you have a task. You don't have all of what you need to work on to make sure that patient is taken care of. You find a way in which you're going to do it. And I can give you an example. I remember many years ago, we had a patient who had a drainage that was continuously draining. None of us could figure out what was happening. Couldn't figure out what was happening. And finally, one nurse came into the unit room and she and I started chatting. And I said, wait a minute, we have to stop this drainage. The patient is losing too much potassium, too much sodium. We really have to do this. This is not working. And she said to me, Sylvia, why don't we put this on a low, very low continuous suction? It would stop the excessive suction that we had going at the same time, because the doctor's orders was for continuous suction. He never said whether it's low, moderate, or what. This nurse came in, we talked about it. She said, wait a minute, this is not going to work. He's draining too much. Also, we need to turn him on his other side. Not that he's going to maintain this fluid, but it's going to help him in a comfortable position, because we had him on his back at that time. She said, oh, no, his back is going to start bothering him. Why don't we just turn him slightly and let's monitor this and see how this is going to work? And lo and behold, it was just a simple answer to what we had to do. So you have you have no, I know your perception of nursing, and I know what my perception of is nursing. They're good,
Mhm.
excellent nurses, and there are
Mhm.
some nurses who really should not have even gone to nursing school. I hate to say this.
Oh.
Okay. Patient, to me, you have to want to be there to do a good job. You're only there for just the sake of, okay, I'm a nurse, I'm a nurse. It's not going to work. You
Mhm.
have to be a nurse, a nurse, a nurse, but a nurse who feels that your patient is more important than your ego. It's more
Yes.
important when you come into work that day, you come in, when you come into work for me, you come in to work for a patient. I don't necessarily care whether you are an RN with a master's or whatever, or you're a nurse assistant. In my area that I covered when I was working, we were all on the same page. Patient
Mhm.
focus, patient care. If a patient calls for something, whether you're an R, if you're an RN, don't call the nurse assistant to help the patient. You're there to
Mhm.
help the patient. And this is what the focus should always be. Unfortunately, Nicole, I can understand why your perception sometimes is not thing. And as we have to take onus for this, and every person who, whether you are on the top of the hoop or you're at the bottom,
Mhm.
that is what you're in a facility for. That's
Yeah.
why you chose that as your career.
Yeah. No, that absolutely makes sense. And I don't want to be misunderstood. I do want to clarify. When I think of the creative, and I think naturally we gravitate towards maybe artists or writers, but not necessarily, especially for me, when I look at nurses or anyone in the nursing field, I almost see methodical, right? Very methodical, very
Mhm.
structured. But as
Mhm.
you mentioned, there's that creative thought, creative innovation to think out of the box so that you can provide solutions to help patients. And it sounds like you really had some challenges. You had some challenges in the beginning.
Yes, yes.
Go ahead.
One of the things that I worked with in order to make sure that I had the right people at the table on the bus, I started working with some colleges and universities in the New York area, I would not name them, where we
Mhm,
started having monthly meetings. And what came out of this is that in the nurses who were students, when they're in the third year, fortunately, we had a system in the VA that we could use and be creative with. We would look at nurses with a high GPA and we would bring them into our facility as we call them student nurse technicians. They were basically nurse assistants, but we call them, but they were student nurses. And they work throughout my medical center. And that's a program that started many years ago. It was dropped and I rejuvenated it about maybe 15 years ago before also. And then they would be there working alongside my staff. And the
mhm,
fourth year, we have still have them with us. And they were being paid as they were in school because we couldn't take everybody, so we had to select
mhm.
some.
Right.
When they graduated from nursing schools, they became graduate nursing technicians. And at that time, we kept them on still working after state board. And they apply for a job. If they've successfully passed state board and if I had a vacancy, they were hired because they had been with us for 2 years and they've been
Mhm,
working along the bedside with my staff for all that time. And in addition to that, what I started doing, there's a lot of stuff going around that you can't accept a nurse into the intensive care unit unless they have med surg experience. I can debunk that
mhm,
anytime because
mhm,
I have proven that they can be hired. You give them a good preceptor, an excellent orientation package, and they
mhm,
become some of the best nurses. At one point in my ICU at JJP, about
mhm.
70 to 75% of my nurses in the ICU were new graduates.
Oh, they were.
Yeah,
Mm,
were new graduates. And I started this from when I myself was a new head nurse who really was fumbling and didn't really know what I was doing. I started that, and the first 4 nurses I got out of that program, I can say where they came from. They came from College of Monks and Vincent. They would know who the people would know who they are. The college might not remember them. At that time, they were 4 of the brightest and the best nurses I had in that unit. And that is what gave me the idea to expand it. I expanded the program.
Oh, that's amazing. And you have diversity of thought as well. That helps. It helps. So you've been described as a visionary leader. What did you learn in the process of becoming that kind of leader?
What I really enjoyed doing was, if I have a vision, I share that vision first to get buy-in. Because once you get buy-in to that vision, it is like a piece of cake. You have early and honest conversations. You don't wait until things start backfiring before you start meeting with people or before you're telling people anything. You call them together and you sit in a room. Look, guys, this is what I would like to do. I'd like to see if you really want to get on board with me with this. If you don't, I can understand. I haven't had anything that I put forth that anyone have ever said first, oh no, I'm not going to do it. It has always been, let's see how we can do this. And I like being inclusive. I'm known for, if we have an issue or we're discussing a project, whosoever volunteers something else, that part of it is assigned to that person. I'm known as a delegator, but I tend to not, if I delegate something, I tend not to just be on the person's case to find out how they're going. I leave them to find their path. If they have an issue, come to me. If I see that it's not working, we take it back to the group and we discuss it. I encourage teamwork. I encourage staff to seek opportunities. Just don't go with what Ms. Barchue says. If you see something else you would like to do, bring it here and let's discuss it. For example, not too long ago, I worked with, it used to be New York Organ Donor. It's now called Live On New York, where we really worked so hard to get veterans involved in organ donation. And that was a struggle. That was a struggle until I designed my own center at the JJ. And we started working closer with Live On New York. And within 3 years, we were the top VA in the nation recruiting organs for donation.
Wow.
It had been a mandate from central office. Despite the mandate, I had been doing it for years before a mandate came into being. And despite the mandate, it really was in the New York area, and I can brag about this. We took on this as a project, and it was very, very successful. On about 3 months ago, one manager who had worked with me at that time called me. She was ecstatic. We had finally reached where we wanted to go, where we were able to get 3 organs from one donor. Wow. And I wasn't working there, but she knew I had worked on this project for so many years. She called me, I have to share this with you. We finally got what we wanted. In the past, we were getting, eyes and stuff like that, but it was the first time we had, and I would have given anything to be there for that, but I had already left. But at least she called to let me know, hey, we finally made it, where we got big organs for donation. So then I started walking her through the back end. Remember, you got to build, you got to do this, you got to do this, you got to do that. Go back, look at the policy we put in place. But that was really, really, I pat myself on my back.
Yes. I'm glad you're celebrating, because we do have to celebrate our wins. It's so important. How have you managed to go from vision to execution?
You know what? I'm the sort of person who want to see things done. And I'm always, this old adage is your people's person. People say that all the time, your people's person. I have had the support of senior leaders at the JJP, even when I was a staff nurse and then a head nurse, who came up with all these crazy ideas. But I go to the medical center director and I'm left to do whatever I came up with. And because of the personality I have staff who really buys in very easily to anything I come up with, that I think this is something we need to work on right now. Let's work on it. We set a time frame, we set goals. We revisit our goals to see where we are at any particular time. For example, we had, I always envision us having a mammogram suite at the JJP. We never had a mammogram suite and a unit where we can take care of the female veterans. So that became a goal of mine. It became my vision that we have to do this. So what I started doing, our veterans used to be sent to different mammogram areas in the Bronx to have their mammograms done. I form a group of us and we start going to these centers to see really what are you doing with our veterans. We were not really thrilled with what was happening out. So I do my background work first. We were not thrilled with what we were seeing. Then we start meeting with the female veterans. They were not thrilled with what they were getting either. So what happened? What came out of it? There's a mammogram suite at JJP right now that basically another area that I was fully implemented in designing that area. And it was done with a group, not only myself. I don't take credit for everything I do or anything I do, because it's always done with a team who really wants to work with me. Work with engineering. We got some money that allowed us to buy a mammogram machine. We designed the area. We got money to buy and furnish the area based on the fact that it was done not only with us, but with the female veterans. And the day it was opened, it was the female veterans who were there to open this unit with us. So my vision and things that I've done, I had one medical center director who I worked with for about 20 years. Basically let me do everything. Unfortunately, when she left, the new director who came on board, who was initially one of my supervisor, just allowed me to continue in the manner in which I had begun. And I remember one day, and my promotions and where I've gotten to, it's always the staff who I've supervised who pushes me to the next level. Sylvia, you've been doing this, you can do this. Why don't you just do that? Apply for the patient care center director position. You've done everything you can in the intensive care unit. That's how I applied for the position, because they told me to apply for it. And the day when the position was announced, number one, I became the first Black at the Bronx VA to become a patient care center director. And that day when the position was announced, I could never forget it. I wore a pink pantsuit to work, which I regretted. I should have worn a black pantsuit, because
tell us why.
I came back with all the lipstick and everything and the hugs and everything. It destroyed my pink linen suit.
That is a very good problem to have. Yeah. So you've launched impactful programs like the Nurse Managers Conference, Boot Camp for Senior Executives, and the Intermediate Care Technicians Initiative. What inspired you?
The Nurse Managers Conference was something else. Now, here am I with my big mouth. When the VA has what is called VISINS, Veterans Integrated Systems Network. And I was in Network 3 at that time, VISIN 3. And you had the VISIN director who dictates everything. And my VISIN was New York, New Jersey, and at that time it was Connecticut. Am I in the VISIN directors here running my mouth? And I started complaining that they're not doing anything for nurse managers in the VA hospitals. The nurse managers are the ones who run these hospitals. We are caught between senior leaders and the staff that we supervise. We're not getting any recognition, and this needs to stop. I did not know he was in his office. His secretary did not tell me he was in his office. So he heard the conversation, recognized my voice, and promptly called me in the office. And he said to me, "What do you need?" I said, "I would like us to have an annual conference for the nurse managers in this area." He looked at me, he said, "Go for it." I said, excuse me, it takes a budget. You got the budget. He says, I'm giving it to you. Go for it. At that time, Nicole, there were about 350 head nurses in the New York, New Jersey area. And this man is just
Oh my goodness.
what I did. I said, start a committee with 2 head nurses from each of the VA hospitals with education. And we had meetings, we selected topics, we selected speakers, we decided it was going to be 2 days off station. And that's how the Nurse Managers Conference came into being. I was the first chairperson because it was my baby. And even when I wanted to hand it over, nobody wanted to take it. You've been doing a wonderful job, continue. Well, I continued until I later got promotion to another level when I was no longer a nurse manager. But at the 25th anniversary of the conference, they invited me back. I got flowers. I had a big thing thanking me for starting the conference.
Amazing. Amazing.
What we learned from that and what I want, if we have patients going from one VA to the other, we don't know who the managers were in the units that they're going to, but that made us have a camaraderie. If I had a patient going from the Bronx to Manhattan and I pick up the phone, I knew exactly who I was talking to at the end of the line. And it made things really, really much smoother and different. Okay, I can go to the boot camp. The boot camp was my medical center director telling me once that she heard about this thing in Arizona, has conferences for nurse managers called the boot camp. And she would like me to go with a few of the managers. And I took the program from her. And I looked at it, I said, but they have a section here that says, called boot camp comes home. What does this mean? She said, it's up to you to find out. I called the company. That meant they can bring the training to wheresoever you wanted it. So I set it up, bring boot camp home. It's convenient. You come into the New York, but I got a hotel in Connecticut for a week. The director and I selected 30 people, leaders who can come, the chief nurse, the associate chief nurse who can come. We took a week off. We checked into this hotel. We invited the people from Arizona to come to help us because it's Bring Boot Camp home, and this was their specialty. We had a wonderful week, networking, learning, and it showed people who were there knew others and didn't know, okay, this one had this title, they knew the title, they have had meetings, but they've never got to know the person per se. And that week, they were able to get to know one another. It built trust. We went back on station, fully vetted and ready, and started working more collaboratively as a group. It was such a positive experience. And I invited, at this time, it was a different visiting director who gave me that budget, and he wanted to know how much it cost. And I told him to speak to the medical center director. He said, well, I've already asked her how much this conference cost me because he came to the final evening dinner. And he said, she told me to ask you. And I said to him, I don't have a budget for this. She has a budget for that. And you have a budget. So it's between both of you to figure out who spent what. And that was it. But I can talk to you, and I see my time is gone. I can talk to you about the intermediate care technician program. Came up during President Obama's time. It was realized finally that in the Army, you have a lot of medics who are helping with procedures in the operating room, in the emergency department, when they have these tragedies during war. You have the medics that they're working along, medical people. But when they come back out of war, they are having problems finding jobs. Because the medics there, that doesn't mean to say you have the health knowledge here. So they're having issues finding jobs. So they designed a program called Intermediate Care Technicians for these medics. But it was a pilot program. My then medical center director, as usual, whenever she gets anything she doesn't understand or she can't be bothered with, I'm the one who she says, what is this? I looked at it, I said, oh my goodness, this is interesting. She said, well, go for it. I said, Marian, I can't believe you're doing this to me. And I should have learned my lesson that I should never say anything looks promising. So I got together. It was going to be run out of the emergency department. I spoke to the head nurse there, who was Maxine Shillingford, and the director at that time was Bruce Oren. And I said, this is what comes up, and this is what we. So let's apply. So I applied, and I said, okay, now she can't say anything because now I've done the application. It's up, whatever happens. Then I was called for the interview. I said, oh goodness, this seems to be moving in a direction here. So during the interview, we sat down, and one of the people out of Washington, the VA is governed by central office in Washington, who is governed, and we are governed by Congress. And someone on the interview panel remembered me, and that we had worked on a project before for central office, which was so successful. The minute I heard her voice and I knew the project, I said, oh my gosh, I am sure I know what's going to happen. We were accepted for this ICT program. We were one of 45 VA hospitals and the only one in the Northeast. There, we selected 3 people to come into the program. We got the only female Coast Guard that they had in that program came to the Bronx. Oh. We did such a wonderful job that we became the go-to place. We were recognized, we were interviewed, we were published in a lot of the VA magazines and stuff like that with the work we're doing, because we taught them all that was necessary for them to have a certificate to be able to go anywhere, because they become ACLS providers and stuff. They were really good. And at the end of it, we were asked, we did so well, we were invited to write an article in a magazine called, and I have to read, Realizing the Future of Nursing, VA Nurses Tell Their Story. We were asked to write a chapter, and we wrote the chapter about our success. And we were asked, well, you need to give your chapter title. And we saying, oh my goodness, we don't know what to do, what title. And one day I'm sitting here with the other 2 people, and I said, wait a minute, we have it. This battlefield experience comes full circle. And we're told it was the best title we could have come up with. And that was such a success. One went on to become a registered nurse. The other one went into engineering, and one person went to work in the lab and became a phlebotomist. So from that, we really, that is something that we are very happy and proud of. Unfortunately, it was a pilot. It was a good pilot, but then after that, nothing else happened. And that is unfortunate, because when you see the success that this program had in 45 VAs, it should have continued.
Yeah.
Okay.
I can hear it in your voice, all the work that went into it and the impact. What a title, Battlefield Experience comes full circle.
Yes. And I was just doing because we're on the timeline now. Oh my goodness, they want to publish. Everybody have to give a title. We didn't know when we wrote it, we had to give a title. And then here we are, the 3 of us are sitting down the Monday morning. We break our brain all weekend. The Monday morning in my conference room, we said, I said, oh my goodness, I got it.
And I just came to you.
When I said what the title was, the person who edited the book and everything said it was appropriate title. So
it seems so.
But I have had an illustrious career at the JGP. I had an opportunity early as a head nurse to move to another facility that was paying me a fortune, but I had already fallen in love with the veterans and felt that they deserve my skills, and I deserve to help them as much as I can in any capacity I can. And money just is not the answer for everything. And I met veterans who are 102 years old, 100 years old, who are so, wow, my goodness. It was a pleasure serving them.
I can imagine. It was what an accomplishment. I mean, all of your accomplishments. And I do want to talk a little bit about your publications, and not just the ones that are published in medical journals like Battlefield Experience Comes Full Circle, but you also have Should Children Visit Patients in the Intensive Care Unit, still patient focused. and even contributing on a book titled The First Year of Nursing. So you've shared your knowledge and almost mentorship through your writing as well. I do want to just bring it full circle to book titled My Sister, My Friend, My Miracle. And then you have another book, The ABCs of Women's Health. What was the impetus to move away and focus on this area?
Okay, my sister, Sonia, at the age of 29, suffered a medical emergency. It was a tragedy for our family. She had just graduated and was waiting to go into law school. She had 6 schools that accepted her, debating which one to go into, when my mom called me at work the day and said, Sonia, in the morning, complaining of a headache, and now she had right-sided weakness. And those 2 things, I just dropped the phone and ran, because those 2 things meant it was a danger signal here. And, I didn't have a cell phone at that time. And when I was leaving, I drove from the Bronx to Greenwich, where we were living, in 18 minutes, just to get home to pick up my mom, to continue on into Norwalk Hospital, where my sister was admitted. As a critical care nurse, when I walked into that emergency room and I saw my sister, she was shrunk down to basically nothing in her bed, and she was having continuous seizures. And I knew that we were basically in trouble with her. She was unresponsive. She was already paralyzed on her right side. And it was a tense time for this family. But what I learned during that time is, it was really true, how important it is to be a patient advocate. I became my sister's patient advocate, in as such as when the surgeon the night talked about operating on her, I said, no, hold off, too soon. She was having medication to stop her seizures, but the medication was not working. And but reaching out was very important. I remembered many years before, I had gone to a critical care conference in New Orleans. No, it was Atlanta that year. There were 11,000 nurses in Atlanta there, because it was an intensive care program. And I have a friend who was in California at that time, and I didn't tell her I was going to be in Atlanta. I wanted to surprise her. I walked into that massive arena the morning, and the first person I saw was her leaning over, drinking some water, and I touched on her shoulder. She was shocked, but she introduced me at that time to a nurse who worked in a neuroscience center at Stanford in California. So when my sister had that catastrophe, I was planning on going for another conference out there. I called her. She put me in touch with this person, and she said to me, oh, if you can't bring your sister here for me to care for her in California, the only person you can take her to is Yale New Haven, to Dr. Awad. I can call his name because his name is in the book, and he gave me permission. And I said to her, okay. And I called Dr. Ward, but because unfortunately Sonia was in Norwalk Hospital, he didn't have privileges here, which is something I've always disagreed with in this country. You shouldn't have to have privilege to go into another hospital to see a patient, but that's the way they say, not that way in England. He couldn't come to see Sonia. So that meant she stayed in Norwalk Hospital. But within, I think it was 4 days, she started waking up. Still paralyzed, but gradually waking up. So it gave me some time. And the thing is, it is that one evening during all of this back and forth, I was tired. I did not know what to do. I got a call the Friday evening telling me that this Dr. Steinberg in California wants to speak to me. And I'm saying, wait a minute, I don't even know him. And he came on the phone, he introduced himself and told me, don't make any decisions. He would guide me from over there. Send all the MRIs, everything to him, and he would guide me. You know, it took something, and before he ended, he said, how do you know Nana? It was the name of the nurse who did it. I said, we were critical care contract. He said, you're in critical care? I said, yes. He said, I'll do anything to help you to care for your sister. And cut the long story short, I eventually I had to take my sister, AMA, in her condition from the hospital she was in, oh, I already said the name, from the condition she was in to be here so she can be covered by Yale. That was a decision that was a hard decision. It was a hard choice because from that hospital waiting here, and now I'm talking to you, Nicole, I'm looking across the dining table, and that's where my sister had collapsed when my brother found her. So it's taking me straight back there. Anyway, Sonia, I wrote about, as a nurse, you always go to document, encourage to document. So I used to make notes, and that book came from notes that I was writing. And I have to do an update because today my sister ended up having brain surgery at Yale 5 months after the stroke in the May. And then in September, she still went off to law school as she had wanted to. We thought it was too early, but she still went. Didn't really do so well in the first year law school because the promises made at that college were not promises not kept. And she really could not continue there. She took a surgery and do public policy, then went back to and did her law, completed her law degree at Regents University in Virginia. But that made me publish that book. Right now, I have to update it because Sonia has done so much with her life since then. She has rebirthed. And one thing I need to say is that the day she was having surgery, I stood there talking to her and she was a scam. And I'm saying to myself, listen, I'm in healthcare. If I was going to have brain surgery, I would really do. I'll be sedated now. But she's up and talking. And I said to her, Sonia, I commend you for this. And she said, you know, I've accepted this. She says, in that operating room, there are going to be a lot of people. She said they're going to be the surgeon, but they're going to be God's angels there and God's hand guiding him. And the surgery that was supposed to take 8 hours took 4 hours. And when I saw the doctors walking towards me, I said, oh my God, my sister died on the OR table. My mother started praising God. And I'm saying, huh? But it's the people you meet in your path, because the night of Sonia's surgery, here am I at Yale, New Haven. And I heard this nurse in the ICU talking so fast. And I said, hey, I only know one person who speaks like this, but she and I had done a nurse manager's course at Fairfield University. I said, but she can't be here. She's a head nurse somewhere. I went to the door. She turned around, looked at me the same time. What are you doing here? I said, what are you doing here? She said, I work here now in the ICU. And I told her about my sister. She said, I'm changing my assignments. I'm going to take care of your sister for you tonight. And that's exactly what she did.
That's beautiful.
Yeah, we had a lot
I
of
just had chills
in the past. And the reason why the book is called My Sister, My Friend, My Miracle. 1 year after all of this, I traveled to California. And I met the doctor who helped me. And I was sitting in his office because my friend gave me half an hour with him. And he walked in with a team of doctors and he said, this is the person whose sister is a miracle. And I looked at him, I said, yeah, she's a miracle. He said, you don't understand. If that knife had gone just a few feet right to the left or to the right, she could have died on that OR table. I said, but you sent me to Dr. Awad. He said to me, I trained Dr. Awad. So he knew who he was sending me to. And Nicole, after that, I got some magazines about this doctor in California. He is the person who implemented the treatment for the arterial venous malformation my sister had. All the things, the equipment they're using in the operating room was designed by him, which I never knew at that time. So when I was writing the book, I got his permission to mention his name and I got all the doctors. And it's a longer story, but that really was my second segue into how important it is to have a patient advocate anytime you go to see a physician or you go into the ED or you go to a hospital. It is very important. So the ABCs of Women's Health came in passion again for women having knowledge. When Stacey wrote a book on financial literacy, everywhere I went, they were asked to help her. They'll come up, so what do you do? As if I'm doing nothing, just selling her books. And I would say, I'm a nurse. And then the questions start coming. I have this happen, that's happened with my husband. And so the ABCs of Women's Health is a simple format, which I would love to get in the Caribbean because I feel that it needs to get in the countries where women needs it so much more than we do here. so that they know how to do the self-breast exam. How if you have your abdomen you got this abdominal pain for so long, it's not going away, what it might be, what you need to, and it's a guide and a reference. And if when you go through it, there's a part there for women. There's a section there for queen. I couldn't think of, there are not many illnesses with queen, but I consider myself and every woman a queen. So that chapter is the queen is written for women.
Oh, what a blessing. And I'm grateful for my copy, I tell you.
You're welcome. And as you can see, we had some empty pages. So we wrote quotations by well-known women. We chose what quotations we wanted to go there. And that's how the ABCs of Women came about, just trying to reach out there to people who basically want some guidance. There's a full section on patient advocate where you need to have a patient advocate. I think we addressed as much as we can in that book right now. And thank you for asking about it, and you're welcome to your
Yes,
just give me
important.
feedback.
I will. I definitely will. I promise I will. It is on my list. It is because our health is so important. Sometimes we're busy pouring into other people, or we're focused on accomplishing so much in our lives that our health goes by the wayside, and we neglect ourselves.
And that's what women do, and that is what's in the book, reminding them not to neglect yourself. And right now, especially where a lot of women are in this sandwich generation, that's a real thing that a lot of them would tend to do, take care of the parents and the kids, the husband, and they're not thinking about themselves or caring for themselves. And that's very important. There's a section there teaching people to do self-breast exam. We touch in as much as we can put in that book. And the testament for that book, Nicole, is that it was edited. And one Saturday I said to Stacey, I've got an idea. Why don't the two of us who authored the book meet with two people who have no knowledge in medicine or in healthcare? And we sat here by Stacey, and questions that came from the two people who know nothing about healthcare found itself in that book that day, because there were questions that needed to be asked and answered that Betty and I did not think about.
And that's why it's so important to share the work that we're doing, to have the committees, like you said, the groups of people working together, diversity of thought and mind. And I do want to commend you. I want to say thank you for the work that you have done and continue to do that focuses on taking care of self and patient care. And for us, right? We are the patients ourselves, right? Think of ourselves as patients. So that's important. I do want to point out, because you've mentioned Stacey's name more than once, and our listeners may not even know who Stacey is.
Okay. Stacia Morris is my sister. My younger sister. She's creative. She is creative.
I want to ask you, what has leadership taught you about yourself as a person, and not just as a professional?
You know what leadership has taught me? Oh my God, I can say so many things about what leadership have taught me. It has taught me that throughout life, there are many hurdles, and it's how we get over those hurdles that make us the person that we become. What I've realized is that we are not in a cocoon. We are not, our accolades should be credited to others, because there are others who came before us. My leadership has taught me how to give back, to do the best that I can, and always to look out for the others who are coming behind me. Make space for them on that ladder. You're not up there and you're going to look back and say, let me see how you're going to get there. No, that is not what leadership is about. I have determined, and I agree with my sister Stacey, back to her, who did a speech the other day, a presentation the other day, saying leadership is not a leadership or leaders is not a title. It's basically how you walk among people, how your attitude is. I've heard so much feedback on myself, and as recent as 2 Saturdays ago, I went to someone for lunch who I had supervised, not directly, indirectly before. And she held my hand and she says to me, I've known you for so long, but you've gone up the ladder, but you have remained the same. And I said to her, you're the second person who have told me this. I remember, Nicole, one Monday I got to work and there's this person walking with a cane. And I said, oh my goodness, what did you do to yourself over the weekend? She said, Miss Barchue, I have MS and it's getting worse. She said, but you know what? I've been meaning to come to see you, but I can tell you now, I've known you since you walk in this medical center as a nurse. You've taken so many different assignments. You've moved up the ladder, but you've remained the same. And I said to her, that is the best thing anybody could say to me on a Monday morning. And thank you very much. And this is what, to me, leadership is about: acknowledging that there are others who have helped you and supported you. You did not do this alone. You did it not because of yourself and because of who you are. Came up from strong parents who, I'm a very ethical person, and ethics and my integrity means so much to me. I think I got a lot from my father, and he really has been one of my major role models. And my dad taught me a long time ago that never look down on a man unless you're looking down to help him out. And that's something that have stayed with me throughout my life and throughout my career. I believe in doing the right thing, not having anyone to question something that you have done because it doesn't look right, it doesn't smell right. For me, it's, as I said, it's giving back, it's volunteering, looking out for the less fortunate. Even now, I do a lot of I have a lot of calls and I do a lot of conferences with people who either I supervise in the past or have been referred to for some guidance. I do a lot of that. And my thing is, have fun with whatever you're doing, but always remember to give back. Remember to step back, because sometimes we really have to step back and listen to what others are telling us. We don't always have the answers. Leadership means collaboration. It means sometimes walking in other people's shoes in order to understand where they're coming from. We should, and I mentioned ego, we should stay grounded. Grounded in your faith, grounded as a person, and knowing that each journey begins with one single step. And it depends on who you take with you as your companions on that journey and the outcome of that journey that tells you whether you've done the right thing or if you need to go back and reevaluate what you want. Leadership also means that you need to apologize when you've made a mistake. And a lot of people don't know how to say, I'm sorry. And that is very important when you're supervising folks. You don't ever behave as though you're always giving orders. You need to sit and listen. Look at the table. When you're going to walk in a room, look at the table around you. And don't ever feel that you are in total control, because none of us are in total control. Anything can happen in the blink of an eye. And it would, you don't ever want to find yourself in such a situation.
Thank you for such powerful advice. Such powerful advice. I do want to ask you, for those who want to bring creativity into their own fields, what are some practical ways they can use creativity to drive innovation?
I think a lot of time being creative is all well and good, but it's from getting that creativity to the next level that's important. And you really have to to me, you have to set landmarks. You can't just say, okay, I want to do this, and you expect it to be done immediately. You have to put a process in place. And the process could be as simple as you want it to be, or it can be as elaborate as you want to be. For example, I remember once when I designed that ICU, I knew what I wanted because I knew what was necessary to bring patient care and the staff member face to face. So instead of having the room that the patient is in, what I built outside the room is an area where the computer is and the staff member can sit, and as the person document, they can be looking at the patient at the same time. So that was what I wanted to see happen in order to make it was for efficiency and effectiveness. Because when you're looking at your patient, you're going to remember something that you might have forgotten if you had moved away and gone back to the nursing station to do that, to make that documentation. So have a process in place, have some parameters with whatever you're creating, have some parameters, because you need to set guidelines and time frames, and you need to know each step of the way where you should be at any particular time.
Yeah, that makes sense.
Always have somebody who can, for example, everybody need a mentor. I have a lot of mentors. I have one mentor who I would call her and she would agree with everything I say because I wanted to agree with everything I said. I have another mentor who say, well, you know what? Maybe you should do A, B, C, D, F, and G. But then my third person that I would call, and she's the last one I would call, who was telling me, stop it. This is what you're going to do. I'm not dictating, but this, in my opinion, is the right thing for you to do. Go back and revisit it. And not many people would tell people things like that. They would just leave it and go with the flow. But you need somebody who would tell you, no, I think you're on the wrong path, and I think you need to revisit this. So in going from creativity to innovation, there's certain steps you're going to have to take. You just can't go from one thing to the next. And knowing that, as I said, it's a journey. You begin somewhere, and if at any time you feel that this is not most of the time you don't know the outcome. The outcome tells you whether you made the right or the wrong decision. But if you're going along the way and you realize, wait a minute, this is not the outcome I'm looking for, then you need to go back to step one.
Yeah. You need to go back to the drawing board.
Yeah.
Start again. And looking back at your 37 plus years of service and leadership, amazing. Congratulations. Yes. What do you hope your legacy will inspire in others?
My legacy, be comfortable in your skin, number one. Okay, be comfortable in your skin. Know who you are. Okay, be comfortable in your skin. Always do the right thing. Do not ever let anyone question your integrity. Once someone have lost trust in you, trust can be rebuilt, but it takes a very long time to rebuild that trust. And my thing has always been, I want people to trust me. So I am going to tell you the truth as best as I know how. Not criticizing you, but trying my best to let you understand that what you've just done was not the right thing. Remember, people, there's always an open door. Okay, there's an open door for you somewhere. The doors might be closing, but somewhere there's an open door, and always think there's an open door. I heard something I never thought about. The other day, one person said, if the door closes, go through the windows. I never heard that before. And I'm saying, I don't want to go through any window. I want to walk through the door. And you reach for the moon and you reach for the moon and you don't settle for the stars. But I would like people, and you lead by example and you treat everyone with respect. I was known to talk to the house, everybody. As I made runs, I talk to everybody. Everybody make this team, everybody make this facility run, everybody make this place much better. I found a quote the other day that I really like. Can I quote it?
Absolutely.
Life is made significant by its impact on other lives.
Oh, say that again. I like this.
Life is made significant by its impact on other lives. It's Jackie Robinson.
Oh, wow. It's powerful.
I love it.
Profound. Yes, me too. I tell you, what a life of impact and excellence, Sylvia. If you could leave our listeners with one message about living a life of passion and purpose, what would it be?
Define and find your purpose. Define and find your passion. It must be yours. No one should tell you what your passion should be. Stay grounded in your faith and always, always be your true self.
Yes, yeah. Thank you for sharing. Well, we've unpacked a lot during our conversation. Is there anything that I have not asked you that you would like to share with our listeners?
One thing I'd like to share is that no matter what you do in life, everyone is not going to be happy with what you've done. or what you said. But as long as you within yourself know that what you're saying is helping someone, continue helping people. Yes, we're going to have a lot of pushback in life. We're going to have drawbacks in life, but you always have to go with your passion, your purpose, and focus. I think I tell a lot of people always do a SWOT analysis on yourself. And whatever you find are your strengths, continue to work on your strengths. Whatever you find as threats or weaknesses, continue to look for improvement. Opportunities are always out there, but look at the opportunities that are facing you. See if it's going to be what you want to, how you want to portray yourself. If it's not how you want to portray yourself, back away. Always have a mentor throughout your life, whether it's a career mentor, a personal mentor, always have one that you can go to and say, well, listen. And if one day you're having a hard time, know who you can reach out to discuss what's bothering you. As I kept saying, be true to yourself, be true to the people. You don't want to disappoint people, but sometimes it happens. Learn to say, I'm sorry. Learn to ask for forgiveness. Learn to look at, when you're communicating, always feel free to speak your mind. If you're in a situation where you cannot be honest or truthful, it is best for you not to say anything because you really don't want to upset anyone and you don't want to create waves. Find someone you can trust. It is very, very important to have someone that you can trust and who you can talk to openly, knowing that it's between you and that person. I think that is very, very important because if we cannot communicate openly and freely and frequently, then we have an issue where you keep everything in and it's not the right way to do. Stress causes so many different illnesses, and I think we need to focus more on our stress factors and having someone to help us whenever we need help. I feel that sometimes we don't know how to ask. And I think that might be one of the biggest problems, not knowing who to ask and how to ask. But find someone who you can talk to and you can trust. Go back to show kindness. Show kindness. Don't be judgmental. We are not here to judge anyone. We can all make mistakes. But as I keep saying, always know how to say, I'm sorry, and when to say you're sorry. Always knowing, stopping and saying thank you. People say, smell the coffee. I said, you can smell the coffee, but always knowing you have to say thank you.
Sorry.
You have to ask for forgiveness. And these are just some of the humane things that you have got to do.
I just want to say thank you so much for being on the show. It's been an honor.
And I am honored to be on your show, Nicole.
Thank you for tuning in to today's episode. I hope you left feeling inspired and energized to follow your own path with purpose and creativity. Don't forget to subscribe, leave a review, and until next time, keep creating, keep dreaming, and keep living your purpose.